My name is Daria Jerauld.
And I'm Valronica Scales.
We are both board members with ThyCa, and we both have received ethanol ablation. So we're just going to tell our stories. The idea of this session was to let you know what it's about. What does it feel like? What led us to ethanol ablation? Because maybe it's something that you're considering as a minimally invasive procedure. And hopefully our experiences just help you. I'm going to hand it over to Val, and she can tell her story.
So let's do a quick preface. We share our stories not to scare anyone, but to provide an opportunity for anyone. Oh, hi, Janet. Thanks for joining. For anyone who maybe has heard from their doctor that ethanol alcohol ablation therapy is an option. So let me tell my story quickly. I was diagnosed in 2015 with papillary thyroid carcinoma in August 2015 and had my surgery in October 2015. I learned quickly after that I had the tall cell variant with hobnail features, and I had 99 lymph nodes removed, 33 which were cancerous, and I had cancer running down my chest, on my clavicle, and down the back of my neck. My doctor, Dr. Ryan Jackson, asked my mother if I had been exposed to radiation because the amount of cancer in my body, and specifically my head and neck, was related or correlated to folks who they've seen at Chernobyl. Of course, we were a little like, how is this possible? So I went through the whole steps that everyone goes through, or that most folks go through, and had my RAI treatment, and found out I was RAI resistant, which is not common. Only some people had that. And learned soon after that I had to do external beam radiation, which I was very upset about. External beam radiation from my chin to my chest to my sides. And I did 30 treatments of that from the end of November, so right after Thanksgiving, to New Year's Eve, 2015. So all of this happened in a 5-month period very quickly. And then I had my scans 4 months later. And during my appointment, in those 4 months, hi Claire, in my 4-month period, the doctor pulled up the scan, and the scan lit up that I still had cancer in my radiation external beam area. So in the zone, which meant that the external beam radiation didn't work for me the way that they would have hoped. So what happened is that my doctor, who was amazing, said, I'm going to send you to my doctors. I cannot cut your neck back open because you have had external beam radiation and you have striated muscles now. So what I recommend is ethanol alcohol ablation therapy. We don't do that here at WashU, Barnes Jewish, but we do have colleagues at the Mayo Clinic in Rochester, New York, who I can send you to, who will do it for you there. So I made my way to the Mayo Clinic that summer, 2016, and went through all of the appointments, getting ready, getting prepped, and finally later that year, I had the ethanol alcohol ablation therapy. If you are not familiar with what ethanol alcohol ablation therapy is, it's a targeted therapy that there's really no other way to explain this. I'm just going to say it.
Yeah, so that's why we're here.
Yeah, they inject your cancer cells with 99% ethanol alcohol. You are not asleep. You are wide awake. They localize it with some pain medication, and the nurse holds your hand while they do 2 passes in whatever lymph node that they are targeting or the area that they're targeting. And I had 4 passes, 2 in one day, 2 the next day, and came back 3 months later, and the nodes were gone. So it's a targeted therapy that, while it is a little painful, is very effective, is less invasive, and I recommend it. I recommend it because I've been through it. I'm still here, and I didn't have to go through another surgery. So that's my story about ethanol alcohol ablation therapy.
So we're doing this together. Oh, hi, Dr. Bulling. Come up over here so we can see you. We have an audience member, but he's also a doctor. So now we have to be careful what we say. So my story is different. What led me to ethanol ablation? So I'm more of a garden variety papillary thyroid cancer patient, very well differentiated, was diagnosed in 96, had an early recurrence like 3 months later, which wasn't probably a recurrence, it was probably there, and needed a surgery for that. Kind of grew another tumor when my TSH was high for radioactive iodine. And then I got 16 years off. Always had like super low but detectable TG, and then all of a sudden thyroglobulin, all of a sudden it jumped from 0.4 where it was hovering to 1.2. I happened to be at the Mayo Clinic for something completely unrelated. I was there for hyperparathyroidism. Hypoparathyroidism runs more commonly in our community, but I had the opposite, had hyper. And while I was there, my endocrinologist said, we'd really like to retest your TG and do another neck ultrasound. And I'm like, why? I just had that done 3 months ago at another institution. And they said, well, we'd like to do it. And I'm like, I'm at Mayo Clinic. I'm going to say, okay. And they found one pesky little lymph node that was positive for papillary carcinoma recurrence in year 16. Crazy, crazy. But they said I was an excellent candidate for something called ethanol ablation. And I happened to know what that was because I had an endocrinologist years prior who had told me about it. And she said, I'd like you to try and get into Mayo Clinic so that this can be an option for you in your future if you should need it. My didn't cover Mayo, and then all of a sudden it changed, and it did. As soon as it did, I switched. But again, there for something unrelated. So they find it, and their criteria for me, and I don't know if it's the same for everybody, but for me it was 5 or fewer lymph nodes involved and not next to any critical structures where it could do harm, because it causes scarring. You're essentially scarring the tissue with ethanol alcohol. I met that criteria, and I went in for my ethanol ablation, and similar to Val, you are wide awake. You don't have to fast. You get to eat breakfast for those of you that like to eat, and you go and you're in a kind of a hospital setting, like a clinical room, and the nurse holds your hand, and the doctor injected the area with painkiller or lidocaine or whatever it was. But they can't inject the lymph node because it would dilute the solution. So the general vicinity is numb, but not where they're injecting. So there's a little bit of pain involved, but they're constantly asking throughout the process, how are you feeling? Are you feeling okay? Do you want us to stop? And you have to be careful to not swallow, so you kind of like brace yourself and they take a pass. My lymph node was peanut shaped, so they tell me. So they did 2 passes at the top of the peanut and 2 passes at the bottom of the peanut. And then I had to go back the next day and do it again. So it's kind of funny. Day 1, I was scared and nervous. And as a result, was kind of stressed out. Day 2, it was like, oh, easy peasy lemon squeezy. I did this yesterday. So like no fear, but it hurt more. Because day 2, you're bruised from biopsies like a week and a half before, and now you're bruised from ethanol being injected in the day before, and again. Okay, so 4 more passes, 2 at the top of the peanut, 2 at the bottom of the peanut shaped lymph node. You leave both days. I left with an ice pack on my neck. Same. So you leave an ice pack on your neck. You go into the waiting room and work your way to the elevator, and you find other people with ice packs on their necks. And it's like, why are you here? Oh, ethanol ablation. You're here for ethanol ablation too. Cool. I can't say enough about it. I went back 3 months later. My TG was undetectable. It's been undetectable ever since. That was 13 years ago. 12. I can't do math. 11. I don't know. It was 2012, so 11 years ago. So no evidence of disease for 11 years. And I missed, like 3 days of work for cancer recurrence. I didn't have to do surgery. I didn't have to do a low iodine diet. I didn't have to take radioactive iodine. I know that there are some doctors, surgeons in particular, that aren't thrilled with doing the procedure because it does scar the area. So if they have to go back into your neck, I know that was a precaution that they told me, like, just heads up, if you need future neck surgery, we are going to be scarring the area. As it turns out, I did need future neck surgery because I had to have that diseased parathyroid removed. So it was a big to-do when I had that done, and they had to bring in a special surgeon who her expertise was repetitive neck surgeries. So, that was a caution, but to lose literally 3 days of work over a cancer recurrence was just amazing and elegant. It's the only way I can put it, an elegant treatment. So a really wonderful option. So I'll pass it back to Val and let her talk some more.
Yeah. And the one thing I think we both neglected to mention is that it is CT guided. So they want to make sure that they're going to hit the spot that they are going to inject. And so it is CT guided.
Ultrasound.
Yeah, ultrasound guided. Yes, not CT guided. Yes, okay. Ultrasound guided. So definitely is in the right spot. Yeah. All right. So we have Janet, Hugo, Gigi, and Claire in the room too. We have Dr. Eric in the room. Eric, I'm so sorry. I don't know your last name.
Blomain. That's okay.
Thank you. Dr. Blomain's here in the room too. So we want to hear from you all. Have you all had this procedure? Or has your doctor asked you or told you about it? Are you just interested in learning more about it?
Anybody have questions? If you do, you can, if you want to type it in. Do we have? Oh, no. Okay. I was diagnosed 5 weeks ago, papillary, one nodule on the right side. Let me open that up. One nodule on the right side, about 1.2. Left side has one nodule. It's calcified, but endo wants to do biopsy. I've wanted to look into ablation options. Okay, so what you would like to do is to check out the 2 sessions that were recorded earlier during conference that were co-hosted with an organization called Save Your Thyroid. They discuss radiofrequency ablation, ethanol ablation, microwave ablation, and they got heavy into exactly what you're looking for, okay? And this session is more, we've been on the receiving end of ethanol ablation. We've actually had the alcohol injected into our necks, and we just wanted to share with you what it feels like. And yes, so I'm reading and talking. Yes, those sessions were recorded, so you should be able to hear them. And her sessions from last year were recorded. Jen Holken, who is from Save Your Thyroid. So they're actually already, last year's sessions are already on YouTube. And this year's sessions, they are in the conference site. You can catch them now, unedited. So they'll be a little messy with like, hey, can you hear me? Jazz that happens at the beginning. But in a couple months, they'll be on YouTube as well. So yes, check those out. Any questions on ethanol ablation from in the room? Dr. Blomain, any questions on ethanol ablation from the patient experience?
Yeah, I came here to learn because I don't actually know a lot about it other than that it's as a local therapy. What long-term side effects?
Yeah, you come here and talking to the. So Dr. Blomain is saying he came here to learn a little bit about it, and I'm going to hand the mic to him.
Yeah. What long-term side effects did they, besides the scarring that you mentioned, did they consent you or discuss with you that could happen?
So that's a great question. Yeah, I was told that I could experience nerve damage, and I was told that I could experience damage to the, I'm going to say it wrong, laryngeal nerve. Is that how you say it? Laryngeal?
Yeah,
that one. Laryngeal nerve. Yeah. So yes, there could have been damage to my. Come up here so I can see you. There could just grab a chair and sit over there so I can see you.
Move the audience here. So that's
we move the audience. So yeah, that the usual. I'll say the usual precautions when somebody's going into the neck. It is what was discussed. So like nerve damage to what feeds the vocal cords. And then just general nerve damage. And I can tell you from a nerve experience, from what I felt during the treatment, they injected me into the road, which was up in this general neighborhood where I'm pointing, and I felt it down here in my shoulder. So, and they told me that might happen. They said you might feel kind of like a radiating pain in different areas, and that's exactly what I experienced. When you're awake and you're hearing them, they're looking at the ultrasound and they're saying, it's kind of funny what they're saying, because in my case, because that silly lymph was peanut shaped, they're saying, okay, we're going to aim for the top of the peanut. point here, and we're going to inject a little bit, and then we're going to go over here. I think normally they do 3 passes, and they decided to do 4 because of this funky peanut shape. So I have kind of like a bulge at the top and a bulge at the bottom, right, with like a almost like a waistline in the middle. So got the extra pass, and they're just talking, you know, and you're hearing all of it, and they're asking you how you're doing, and you know, sorry, we're having sound issues in case it's so that if any of you out in Zoom land want to talk, we can hear you better because we were having some issues. So apologies for the feedback, but it was to make things better. But you know, I just said, ow, like, ow, ow, it hurt when you injected me. And Dr. Lee said, how you doing? Is that mic work? Okay. How you doing? And I said, I'm doing fine. You know, it didn't feel great, but I'm hanging in there. And he's like, is it okay if we do another pass? And I said, sure. And he asked me if we wanted to stop. And I'm like, no, I don't want this to last any longer than it has to last. I would like for this to just, you know, be over and done with. So it's very interactive and you're awake. So it's kind of interesting from that perspective.
Hey, this is Gary. Can you hear me?
Yes,
hello?
Very well.
Yes, oh, good.
Very well.
So I'm Jeanette's husband, and I have a question for you because I heard that you both went to Mayo, and we had applied to Mayo several weeks ago and got a rejection letter that they, you know, didn't have the staff to work with our, you know, cancer. So I was wondering if either one of you or anybody could guide us to maybe an endocrinologist at Mayo that we may be able to get a reference, you know, from.
Yeah, so this is the case where you call Gary Bloom because he's so well networked, and he'll get a hold of Mabel Ryder. And that's not a guarantee that this is all going to work. But he's super well networked up there, and you know, try to draw some sort of a connection that way, and see if you can't get in that way. It's funny, I got in because of my hyperparathyroidism, and it was a mystery because my calcium was normal, and I had been told that they like to solve mysteries, and I wrote a cover letter and explained my mystery, and I got in. Kind of weird, but I also didn't know that I was going there for ethanol ablation. That was like a completely weird finding.
Yeah,
that we discovered later on. But yeah, don't give up just because some bureaucratic wall said no. Right. You know, keep pushing.
So Gary Bloom, and if it can't get through to him, maybe Mabel Ryder.
So Dr. Ryder was actually my doctor at Mayo Clinic. She's amazing. And if you have a doctor that has any connections to Mayo Clinic, that's actually how I got to Mayo Clinic. My doctor said, I'm going to send you to the doctors that trained me. And so that's why I went to Mayo Clinic. I didn't have to write a letter. I didn't do anything. He said, this is where you're going. I'm calling them today. And I was there in the next month.
Yeah, that's probably why we didn't have a connection. Yeah. So that's what we're trying to do, is get a connection.
Yeah. So Dr. Mabel Ryder, she's a big ThyCa supporter. She's a medical advisor. She was going to present. I'm not sure if she did present. She was originally slated to present here this year, but I'm not sure she did. She was both. It sounds like she was both of our doctors. Well, she wasn't my doctor. She wasn't your doctor, but she was definitely my doctor when I was there, and she's fantastic.
All right, great. We'll look her up.
My doctor was Dr. Robert Teagues, and he's now retired. And then Dr. Lee is the one that actually did the ablation, but I can't say he's my doctor. He's just the guy that walked in the room and did the injecting along with, you know, the very nice nurse.
He did mine too.
Yep. And then
he did mine too.
Okay, thank you.
Any other questions or comments about ethanol ablation? You want to tell your story? You got to use a mic. You just got to talk into a mic. Hang on. We have a person walked in the room, and she's a recipient of ethanol ablation too. So that's really cool. Okay, stand by, everybody. We have another person that's going to help us. Oh, and now you can see Dr. Blomain too. You're in camera.
Hi. So just to share my experience with ethanol ablation, there weren't a lot of places in the country that were comfortable doing it. I actually let somebody try it that hadn't done it before. And they did do one injection, and within a few months, the cystic change in the node was larger. So it just didn't completely target the entire node, and it didn't resolve the node. This was a peripheral node in my lateral neck. So I went to Mayo Clinic just because they have a lot more experience with it. And they also do something a little differently in that they target the same node in sequential days, because sometimes when you're putting in the ethanol, it creates a little bit of bubbles and makes it hard to see the entire node. And it's hard to tell if you've completely hit all the areas in the node, because they're using such teeny tiny amounts of ethanol. So what they would do, I actually went 4 days in a row, and each day they put a little bit in until they didn't have very good visibility anymore because of the little micro bubbles. And then I would come in the next day and they would check for vascularity in that node. And if there was still residual vascularity, they would put a little tiny bit more in that region and work their way through that way until the final day there was nothing left that showed activity, like there was vascularity there. So they ended it, and that node was successfully ablated. And I can't remember the exact statistics, but they had learned that, you know, if you do one injection of a node, it might get rid of 60 to 80% of them. If you do it a second day in a row, the number goes up, and the third day it goes up until you pretty much, by the time you've done 3 or 4 attempts at it, you're a lot more likely to have succeeded in completely getting rid of the disease in the node. So that was my experience, and I thought it made a lot of sense, and I would go back there. I'm not that familiar with where else in the country they're doing it, but I liked the thought process and the logic of it, and it was not a problem. There was one day, I think it was the second day, when they put a little bit in, and I had a transient burning sensation in my shoulder, and I told them, and they said, okay, we're done for today, and they didn't do any more. And it was just probably, it touched some of the nerves that went out to my shoulder, and they stopped just to be on the safe side, and I have no consequences from that.
And sorry, I missed it. What clinic was that?
Mayo Clinic.
Oh, okay, thanks.
So I'll add that I think ethanol ablation is like part art, part science. I think there's a little bit of art to hitting that node properly. And, you know, I've heard stories of people asking their local doctors if they would do it, and people kind of playing around with it who didn't have experience doing it. And you really want to go somewhere that's more high volume with ethanol ablation. Of course, Mayo is one of those places, but hitting the node in the exact right spot, knowing when to stop, that, you know, you were like, I experienced burning too, but it must have been a different kind of burning. And it wasn't terrible, the pain, and they kept going. So I'm sure that they know that, oh, that's okay, this is not. So making sure that you're working with somebody that's done this before, and that you're not like the first person to experience it with them, you know, like go to a high volume center.
Yeah, I think it's just a matter of technique and being super careful. And then one other thing that I'll mention, if people are going in for a node ablation, is, and I didn't expect, was that I had a fairly significant amount of swelling around the area afterwards, not in areas that they were working, just in general inflammation. So the whole area above the clavicle was puffy for several days afterwards, and it's just a reaction that goes down by itself.
Yeah, I didn't have swelling, but I had black and blue. So I had quite the bruise, which was expected, because, you know, first the biopsy, then a week and a half later, they're poking you a few times, and then the next day they're poking you a few times. So I looked pretty bruised, but it my neck felt a little stiff, but it cleared up pretty quickly. I didn't need anything other than, like Tylenol. Dr. Blomain, you got a question? You can use that mic.
I think it's on. Okay. Because in a lot of cases this is probably in the recurrent setting, I know they're using it more, but it's for the most part an experimental procedure still to a large extent, I think. Do you know, were any of you, or are there any open trials or registries that people that are getting this procedure are on? No?
I've never heard of any. I know that it was classified, like for insurance purposes, it was listed as a surgical procedure, which, because I don't, it's not standard of care, right? But I think that's changing, and hopefully is going to change more and more, even for other methods of ablation, like the radio frequency and the microwave and the laser. That stuff's being done in Europe a lot, and ethanol ablation too. These things are being done more in Europe than here.
I don't really have anything to add.
Go ahead, you've got the mic. And those of you out in Zoom land, if you got questions, please
I don't
fire
know
away.
if anybody has any statistics on the success of radiofrequency ablation versus ethanol ablation, or if there's not even enough numbers to compare them.
These are talking to the mic. Just for our friends.
Yep. And extrapolating from other cancers, the relevant comparison is often pick whatever ablation form you want to do, like RFA or ethanol or whatever, versus another local procedure. So like in renal cancer, they recently published like those kind of things versus like a type of radiation called SBRT, things like that. Like, because then you have to be careful how you design the trial, that because if you do different methods of ablation against each other, you're assuming that ablation is better, I guess. So it's like, yeah, I don't know if there are enough patients that really even ever do a trial. This might be the kind of thing that we're looking at, a relatively common cancer, but kind of a rare population within that cancer that are getting it. So it's very hard to get trials like that. So mostly you're limited to like the experience of an institution that does it. Like I'm curious if Mayo's actually published their experience on it. Yeah.
I'm such a nerd. Before I had my surgery or the ethanol alcohol ablation, I went to, I read some research papers about it. And so they have actually published some of their research. It was a while ago. So this was 2016. I'm sure they have a lot more updated research, but because it's 2023 now, or 7 years out. But in 2016, they actually did have published research on ethanol alcohol ablation. The other thing I would say, so Claire asked a question about due to scarring, would this not typically be recommended? I don't know about you, Daria, or what's your name? Catherine. But for me, it was recommended because I could not have another surgery. So I had too much scar tissue, too many striated muscles, that my doctor said they could not cut my neck again. So I think it's a conversation between you and your doctor to determine what's the best option. So I actually couldn't have surgery, which is why I had to get the ethanol alcohol ablation therapy, because the external beam did not work on me. So that was why I had it. So I think this is just a treatment conversation with your doctor right here.
Yeah, I would second that. It does cause scarring, and if your surgeons, your surgical team might not be thrilled that you want to do this, and if they're going to need to open you up again, then you might want to think twice about doing it, because it might be better to do another neck dissection and clear out those nodes. It just depends on your situation. I was actually quite low risk with a recurrence in just one node. And I was more than willing to say, inject that rather than get cut open again. I've had 10 major surgeries, not for thyroid cancer. Only 3 were neck surgeries, but I just didn't want another surgery. So for me, it was just an elegant solution. Catherine?
I also agree with that it's very circumstantial as to what the node is, where it is, and what your previous history is. And my circumstance was I had a thyroidectomy, a central dissection, and a lateral dissection, and this was one node that was lateral in the neck that I didn't want to dig around, having had surgery in the past there before, and it was superficial enough that it was accessible, and it seemed like a no-brainer to try this. And if it didn't work, could take it out, but just made it an easy, non-surgical approach.
Let's ask our virtual audience again. Any questions or comments? Or, I mean, you're certainly free to type if you don't want to come off mute, as some of you have been. Any effect on lymph nodes? Well, so from my experience, the only lymph node that was affected was the one that they injected, and it killed it, right? It just literally destroyed it. In fact, it did an ultrasound. So I was treated in November. I did an ultrasound the following February, and they found it. It still looked peanut shaped, but it was significantly smaller. All of my ultrasounds after that, they can't find it. They're just like, we can't find it. It's gone. But yeah, I guess if they were to hit another area, right, another lymph node, it could destroy that lymph node. But it's very, very targeted. They're working under ultrasound, and they're going precisely into where they're going. And I guess it's a matter of what tissue they're passing through. But even with that, you know, it's the tip of the needle that's doing the work. So they're pushing into the area, and they're injecting, and then they're, you know, kind of moving the needle, kind of like backing it out and pushing it back in. But they're staying in the node, like they never come out of the node. So they're still in the node. They back out a little bit, and they move over to the side, squirt a little more. And in my case, again, because of that funny peanut shape, they took the needle out and did another complete pass into the bottom part of the node. But normally I think they just stay in the node and move the needle around. Good question. Any other questions?
Does anyone have experience having had ablation done at other centers?
Not us. Anybody in Zoom land? I don't think so. I don't think so. Okay, I think we'll take last call for questions, and then there's no need to belabor the session. And
I think the one thing that's really important here is that if you are thinking this is a treatment that you want or that you need, make sure you're talking with your doctor, and make sure you're getting a referral. And if you can't get the referral that you need, Gary Bloom is the person to talk to, y'all. He knows all the doctors. I didn't go through Gary because my doctor, the Mayo Clinic doctors were my, trained my doctors. And so that's how I got in. But just make sure you're making those connections so that you're seeing the right people.
all right, any last comments or questions? Okay, then I think we're going to call it a wrap, and I hope everybody's had a fantastic conference, and we'll continue to see you around the conference. Take care.
Thank you very much.
You're welcome. Bye-bye.